And then CPPD is that pseudo-gout. This is that one that can fool a lot of people. This is when I'm like, oh, is it seronegative RA? Is it OA? Is it gout? Is it pseudo-gout? Because it's really all of them could look very similar. So it's this acute onset, comes with surgery and trauma, usually much older. If it's younger, there's some risk factors we got to look at that we'll talk about, but usually in the older population. Diuretics can cause it. Hyperparathyroidism is another big tie there. The thing you'll see on radiographs are chondrocalcinosis. They probably won't make you read it. They'll just tell you that it's there. Effectively, we see it mostly in the TFCC cartilage of the hand and then in the knee. It's literally a calcium line inside the cartilage. So you'll see this extra calcium that isn't touching anything and is just there. It kind of looks like a poof of smoke coming out on certain sides. That's chondrocalcinosis. You're literally seeing the calcium depositing itself into the lining of that joint, and that's what's causing the issue for these people. You'll see that positive birefringent crystal again. That rhomboid shape is what you're looking for. Sadly, it doesn't have the same underlying mechanism as gout, so we don't treat it quite the same way. We can't get rid of uric acid and make it better. I can't get rid of your calcium because you won't have bones. So we have to really just treat it symptomatically as best we can currently. So NSAIDs, steroids, injections, colchicine is still on the table for this one as well. There are some people that on occasion use hydroxychloroquine, but that's more for real world, more so than the test. They won't do that. It's these four are the big go-tos. The one they sometimes will mess with is say, oh, what disease should you associate this with or should you test them for? So hemochromatosis is the big one. You'll see they'll give you the blood work up for that, and they'll show you that their hemoglobin is through the roof or their saturation is through the roof or something like that. That should tip you off. Thyroid disease, they'll give you some other stuff for that. Being high or low can cause this problem. And then hyperparathyroidism is the big one, especially in younger patients if you see it, looking for that intact PTH, ionized calcium, etc. And then CKD is the other big one for a lot of people, so checking to make sure their kidneys are functioning appropriately. This is that chondrocalcinosis that I don't think they'd make you necessarily look at, but just so we see it. So neck pain and meningitis-like symptoms can actually show up in some of these people. They'll have this kind of recurrent like rigidity of their neck and pain when moving it. That can actually be gout in some people. They can get a tophus actually in some of their discs in their spine. Or when you get this image of their dens, you'll actually see this little crown that sort of goes around it. That's this thin line right here is actually calcium deposition in that ligament that holds the C1, C2 together. And that's that crown dens. And then there's this line here. That's what you're looking for. It kind of comes out a little bit like a poof sometimes in people. Harder to see on that one, but this is that TFCC where you really see it. It's not really attached to anything. It's just floating in space, this extra calcium that's sort of faint. And that's the chondrocalcinosis. And then also hemochromatosis from a standpoint of x-rays that they didn't give you the blood workup or anything. Those hooked like osteophytes. It's the second and third MCPs. You'll have this actual hook coming off the end of it. Basically, it doesn't look normal. It looks like there's these hooks coming out of your fingers at the MCP bone at the junction point there. So another big hint that they could be talking about hemochromatosis.